Hoslundia opposita is a perennial shrub belonging to the Lamiaceae family and the only species in the genus Hoslundia. It is mostly used in sub-Saharan Africa to treat diseases such as chest pain, stomach pains, wounds, malaria, cystitis, liver diseases, epilepsy, gonorrhea, fever, cough, and sores. Hoslundia opposita, also known as orange bird berry or bird gooseberry, is a shrub with many traditional medicinal uses. Antimicrobial. The plant has antibacterial, antifungal, and antiviral properties. Anti-inflammatory. The plant has anti-inflammatory properties. Wound healing. The plant has potential for wound healing. Antidiabetic. The plant has antidiabetic properties. Hepatoprotective. The plant has hepatoprotective properties. Antimalarial. The plant has antimalarial properties. Central nervous system activity. The plant has central nervous system activity. Postpartum. The plant is used to cleanse the uterus of blood clots and heal vaginal lacerations after childbirth. Purgative. Infusions of the leaves are used as a purgative. Diuretic. Infusions of the leaves are used as a diuretic. Febrifuge. Infusions of the leaves are used as a febrifuge. Antiseptic. Infusions of the leaves are used as an antiseptic.